So while he's pulling up the slides, how many of you have recently just purchased a device within 6 months? Okay, within 1 month? Yesterday? Today? You signed a deal today? Okay. So how are you feeling? Yeah? So are you a little bit stressed? After a bit of drink, your rep talked you into it last night, right? Signing the machine. And then you're excited, and now you have a little bit of anxiety about what you're going to do next, right? With now you have all these technology and stuff. And you know, my rule of thumb is InMode is a great partner, and they have great post-sales services, and that's one of the pluses with partnering with InMode. And I have a rule. After the first, I shared with some of you, if you were at my talk yesterday, I shared with some of you that my launch event, although it was not a record, but at the time, I believe I was 1 or 2 back in 2021 or 2022. We did $165,000 in a 2-hour event, right? And the actual retail sales was actually $217,000, but I don't count that towards InMode because we sold other products in the event. So there's many, many different ways of doing this, and I'm sure now, because InMode has their post-sales team, I'm sure they're going to help you set this up. But I want to share with you how we do it in our clinic, because they could give you the templates, but you still have to do all the work, and you still have to bring the team together. But if you follow their process or follow this process to the T, and your team believes in it, there is no way you won't be able to be successful. And because of this process, when there is a need and I think there's a good technology, I don't hesitate to pull the trigger to buy the machine, because I know if I set up the sales event correctly, a third or half the machine will be paid off after the first sales event, right? And that's really the goal that you should be thinking about. So if you bought a machine and you haven't had a sales event, or you did, you got to redo the sales event, try to see if you could capture the revenue, set a goal, right? And for me, as I shared with you yesterday, I set the goal ridiculously, because I heard Dr. Meningas, he was telling us, oh, he did 150,000. And jokingly, I'm like, I think we can beat it because we're in Erie, kind of like Joplin, right? And my team was like, well, if we do it, I said if you do 100,000, we'll take you on any trip that you want. And then they actually were serious. So I had to sort of eat my words and send them on the trip. So tips and tricks, I put this up yesterday, but I didn't have a whole lot of time, so just want to spend a little bit of time to talk about this, right? So it's very important that you coordinate the time, and if you did get the machine today, this would be a really good time, because you want to set your post-event. You want to do an event usually in the full time. And for us, we start the planning process literally 8 weeks before. So you work backwards. Like, you pick a date that you think you're going to do, but you need to give yourself at least 8 weeks to prepare, so that you're going to get the right people. Like Dr. Geller said, you need to get the right people into the room. This is not an open house. This is not, for somebody to come in and kind of eat your free food and kind of check out your spa. You got to qualify them, and in order to qualify them, you need to go through a certain set of process to do that. So we start with even what day of the week. In the evening, typically in your area, the moms have the most amount of time. And in Erie, Pennsylvania, for whatever reason, we think Thursday night is the right night, because the kids, they're sort of tired. The moms want to go out for a night. It's before the weekend, so they have stuff going on with the kids on the weekend. So Thursday night seems to be like a good night that a lot of moms and our clients show up to our events. And then you got to be sensitive to what are you trying to sell. So if you just bought a Solaris, you just bought some lasers and stuff, well, this is the time. Fall is a really good time, because you can talk about sun damage and all that type of stuff. You do not want to do a sales event or launch event in the summertime for laser, obviously. Body contouring, we find that after the holidays, when things come down, it's actually not a bad time to do it, because everybody's trying to get ready for spring and summer. So that's also a good time to do body contouring event. And before you go through all this work, because this is a lot of work, you need to sort of have a goal set up, right? So whatever your number is, whatever, so you work backwards, like you need to have 75,000 for your sales event. That's your goal, right? So how many patients do you need to get there? And then what kind of packages you're putting, because you need to have 2 or 3 packages for that specific sales event, because you don't want to confuse the VIP patients or the patients that you qualify come in. It's very specific towards what you're trying to launch, right? So our target is usually about 25 patients in my clinic, and we usually need to at least secure 50 RSVP. So the show-up rate is about 50%, even after they RSVP. So to get 25, we know we need to get about 50 RSVPs. To get 50 RSVPs, we need to make like phone calls, right? And we need to get people. We need to get at least 150 people interested in RSVPing in order to really sign up for 50 RSVP. And then 50% of them, you hope that they would show up, right? And by then, most of the time, they really would. Once you have that number down, you're pretty assured that about 20-25 people will show up to your event, and that will give you a lot of relief, because a lot of work that gets put into it. But it's also very important to get your team hyped up, because every team member has to be present in the sales event. And because leading to that sales event, every day in the office, they need to be talking about it. There'd be sign about the event. So, your traffic that comes into your office, that's how we're able to have 109% show up rate, because there are people that didn't RSVP and they heard about it and they actually came, right? And some of them can't make it that day, so they called in to actually buy the package, because they knew we already pre-sold before the event, because they knew they weren't gonna be there that night, okay? It's also really important to create a script to ease your team's anxiety of having a conversation about the event. And you want to be very specific and very targeted, because I have 5 people, I don't want them talking about the event differently, right? So like what Dr. Geller says, you get the team together, you train them, this is one script, this is for that event, you don't deviate from this script, because everybody's going to be talking about the same thing. And then, of course, we incentivize our staff. For the attendee, and for my case, he was like, well, if we reach the goal, we'll go on a trip, right? And we'll shut down the clinic for a week, which is pretty expensive, right? But every team member has a responsibility of certain tasks that we assign, and there's a project sheet that we do, and then we sort of check in on a weekly basis leading up to the event. So it's really important to do that. And I talked a little bit about leveraging the support, additional services. So that retail 217,000, we leverage a lot of our like injectable vendors, our product vendors, and they all show up to the event to support the event and stuff. And it makes it better, because while you're waiting for your one-on-one consultation that I'm going to talk about, they're in the waiting room mingling with your VIP customers and stuff, and they're helping you sell. If they're a really good rep and they're really loyal to you, that's what they would do, right? Okay, so I'm going to talk a little bit about sort of the promotional. How do you promote this event, right? So you first have to create a registration form. You drive traffic from all promotion to a standard location, and that's the list that every day the staff has to make the phone calls or the follow-up from. And we always ask for demographic information, time of day for phone call results. We try to get, during the conversation, try to find out what their pain points are and so forth with really a minute. We create Facebook ads and we drive traffic to that event page and promote education, giveaway, drawing for a package while you're trying to promote that event. And there's a variety of different ways to do this. This is sort of just how we do it. And I'm sure if you have more talented social media person, or however you decide to do that, there's ways to do that. But the key thing is you got to be out there and promoting the event 8 weeks before, and of course more intensive 4 weeks prior to that. Okay. And within 4 weeks, we begin to go through social media, in-off signage, direct patient conversation. And this is key, right? To get the right patients to come to the event, there's a no-show fee. If you RSVP for this very special event and you don't show up, like there's going to be a no-show fee because there are other people that wanted to come to this event, and we limit to only 25, right? So if you don't show up, that means you're taking up somebody's position, and there is a $100 no-show fee. And this really weeds out the people that are really not serious, right? They're just shopping, and if they know that this is a good product for them, they're going to take advantage of your event. They will show up because they're not going to lose the $100, right? They're not afraid to put down their credit card and stuff. And once interested in stuff, a patient should be reminded about the event 2 weeks out, 1 week out, 2 days before, and the day before. Just like we do the same thing for new patients coming into the office. Like we send them text message, remind them that your appointment is here, and so forth. So we do that. And then confirming the attendance through phone calls. So I go through extensive training with my staff about phone calls because I'm obsessive about making cold calls and talking to people on the phone. So this is sort of a bullet point. I'm not going to read through it and stuff, but you can take a picture of it. But really, I tell my staff, and they actually have to practice in the morning, especially the new front desk. I make them come in. I make Tara, my office manager, sit down with them. And the first thing they do is to practice how you're going to talk to patients today, right? And you gotta have, in their mind, even though they're not seeing the people over the phone, if they're in a bad mood, they can tell over the phone that they're in a bad mood. Or it's like, Dr. Lin is making me call 25, and they roll their eyes back. The minute you pick up the phone, you can tell through that tone of voice, right? Which, Chris Santos is talking about it. I think it's a good idea to have AI to pick up those phone calls because they're happy 24 hours a day, 7 days a week, right? So that's really important, and then we print the script in front of them, and after they do 25 phone calls a day for 4 weeks in a row, they pretty much have the script memorized and stuff. So when the patients show up throughout the day to talk to them, they already have that in their mind as well. So it's important to do that. Now, when I first started doing this, my favorite thing, they were going to say, well, I called, and they never picked up, right? And it's like, well, how many times did you call? Right? Like, well, I called every day. But what we found out was if they call and you hit voicemail and you dialed again, it's about 50% they actually will pick it up. So I think it's worthwhile doing, so we double dial them and that type of thing, okay? And then this is sort of when you pick up the phone, what do you do, right? And I didn't make this up. This is all part of the sales training. And as I share with you, I really like the book 10X by Grant Cardone. He's got a great sort of sales training module online. It's relatively inexpensive, although, he's trying to sell you cars and real estate type of thing. But the technique and stuff is really good, right? So the important thing is, patients usually say, when you pick up, you don't say hello. You just directly call out their first name. And then the other patients usually are kind of shocked, like, well, who is this? How do they know my name, right? And they will be like, well, who is this? And then you sort of go into the conversation. Then it sort of loosens it up, and it's hard for them to just not talk to you because they now know who it is, right? So that's how really the beginning of the script, how we go through the calls, okay? Now, event setup and execution. So as I said, everybody plays a role. We, the provider, do not give the presentation. We have a pre-prepared slide deck, and I have my office staff talk up our providers, right? Aaron is really great doing injectables. Aaron is really great doing the quantum. Dr. Lin is really great doing the body type, face type. They usually work together and that type of thing. But they introduce the technology, to the audience, and then sort of talk up the procedure. And to all the presenters that said, we have to treat our staff, all of them have experienced this treatment, so they can talk to the audience about it and say, I had my treatment done, when we first got the machine, and it took me 2 days to recover or whatever, or I have no downtime and all that. And that means a whole lot more than, because they know they're there for me. We're trying to sell them a product, but they want to know from other people their own experience besides from the providers and stuff. So I think that's really important. Then we have and then the providers are in the back. We have 8 exam rooms. We usually split up, and then we do this, one-on-one quick dating type of thing. And the point of that is they already know why they're there. They already know what the event is about because you talked it up so much previous 8 weeks. So when they're there, they're just wanting to see the provider to see which package to get. Should I get this or should I get that, right? And then it's like they go in, it's literally a 2-minute conversation, and it's like, I think you're good for package A because you have A, B, C, and D, and it's on a piece of paper. And they're like, great. And you're like, good. So you move on to the next station. That's where they put their deposit down. And then you schedule them for a procedure sort of appointment, and you tell the patient, that's where we're going to go over in detail, how the procedure is going to go, and we'll go through all the medical history, et cetera, and then that's sort of because you want that moment, to have them put down the money, right, to commit to it. And so that's how we sort of do that, okay? And then, comprehensive offering more device options equal more revenue opportunities, and patient who come from body type may also be purchasing injectable, PRP, fillers, neurotoxins. So it's just sort of depends on your practice and what you're offering and stuff, right? But don't forget, if you're buying a new machine, you still want to focus on that machine, whatever that machine can do. You don't want to just, because it's a sales event, a launch event for your new machine, right? It's not for your whole spa. So that's important to keep in mind. So these are just sort of examples. I don't like to give discounts, but in Erie, Pennsylvania, I think our demographics is a little bit different than, let's say down in Miami or in South Florida, for example, right? So inevitably, they, like in Erie, for some reason, they have to see that they're not going to spend the money. It's not special if they don't see like a retail and then like a quote-unquote discount, right? But we don't really discount it because depending on what we're trying to put together, you get close to what the retail value is and stuff. So, we would do like a one and done Quantum and Morpheus 8, for example, and I can't garner $4,800 for a face in Erie. So we sort of say, well, the regular price is $3,900 and the launch event price is $29.99, right? And you sell to the 25 patient that shows up, right away your revenues, for example, is $74,000, $75,000, right? So that's how sort of we do it. So depending on the device you have, depending on what you're trying to launch, with all the InMode devices, you should be able to put a package together in neighborhood value about $3,500 to $6,000, right? Depending on what it is. So I was able to do $165,000 with the body type because that day, all we're doing is body type. So the lowest amount package they could get was $5,000. The highest at the time was $15,000, right? So that value goes up, and that's how we were able to reach that, okay? But realistically, I think that most of the packages that if you set up about $3,500, we have done this over now every year, at least twice a year. We consistently come in anywhere between $65,000 to $75,000 if we put the package correctly, okay? So this is sort of closing the deal. Patients typically deter from commitment. They need to talk to their husband. They don't have the money right now. They want to do their research and all that. But we really don't have that issue during the sales event because you should have pre-qualified all these people. If you're having that issue, then the team didn't do a good job pre-qualifying those people, and now it's tough to then that's not really a sales event, right? So we usually, to ease their fear, we require them a $500 non-refundable deposit to guarantee the event price. And then they can schedule their procedure anytime after that. And that's a non-refundable thing. So for a $500 commitment, I think that usually they're pretty good. And then, of course, you create urgency and all that, right? So we talked about all the other stuff before, okay? And then, again, this is sort of a secret sauce to a successful launch. The educational presentation and Q&A is important. That's the setup. The one-on-one consultations where you don't get into detail with them, that's also very important. And you literally limit your time to 3 to 5 minutes. And if I'm going over because the patient wants to ask me other stuff, my staff is bringing in the next patient and say, sorry, your time is up. Go on to the next station and stuff. And it may sound like a little bit rude, but they all understand because up front we told them this is the way it's going to be. Then we do some giveaways, and usually the giveaway is the same area that they're giving the deposit and schedule scheduling, because usually there's a line, because you have 25 people to get through. We usually get through that within like 45 minutes to an hour. So usually there's a line waiting for them to put the deposit down, so you don't want to lose the interest. So that's where the reps from other people in our, kind of socialize with them to kind of entertain them before they get to the deposit side of things, okay? And this is sort of just an example, how to increase revenue during evolve treatment is an example. Like, I think we heard the last 2 days to death, bundling is the way for you to create value and also increase revenue per patient, right? For the same amount of effort, you are trying to maximize how much revenue you can get for that same amount. So for us, this is sort of just an example. We offer sort of a membership for the Evolve and a 12-week session, and this is what we do, okay? I just want to talk a little bit, I'm shifting gear a little bit. This is sort of post-sales event, launch event, so now you have successful launch event. I think one of the things important for me that made me successful was on a day-to-day basis, you need to be obsessive about your staff, making sure they bring in new consults in, right? And yes, you have all the social media, you have the digital marketing, you have your website, you have SEOs and all that type of stuff. But when you build a base, at the end of the day, if they walk into your office and they don't buy, that's your biggest target, right? And you need to focus on those people. You have to have a list of those people, and every day you have to designate your staff to call those people for follow-up, right? And that's the exercise that can generate 1 to 2 consults to come in through the door. And then when they do come in through the door, because you're spending a lot of money to bring that patient through the door, you need to have a process to make sure that you at least have an 80% or 85% chance that you're going to close that deal. And that sets up from the very beginning of the forms that Mac talked about, of how you present to them when you walk in. But more importantly, as a physician or as an MPPA provider, what Aaron's my PA, what we do is we usually sort of, whatever they come, how can I help you? They usually tell us, oh, I'm here for Botox, or I'm here for, I want to get my lips done, or whatever. We let them tell us what it is, but we always have a format to go back to address a volume issue, laxity issue, and skin color and quality issue. Why? Well, because volume, I want to be able to do injectables for my fillers or my PRPs or PRF or whatever that your choice is. Laxity, I have Morpheus 8, I got lasers, I got quantum, I got all kinds of stuff that I want to be able to give them a care plan, right? And then, of course, the skin quality, I always talk about color and pigmentation and even laxity. That's all related and stuff, because I have an IPL laser, Lumecca, I have, whatever your laser is to actually solve those problems. And once you let them tell you all the problems, I don't let them leave the room without talking to them about these 3 things, right? Then I usually tell them that this is not an episodic thing. You're in here because you want to get better. It's for wellness and all that. So this is a journey, right? So this is what I think you need, and what do you think your priorities are, right? If it's lines, volume, laxity, whatever, let them tell you. But the plan is really the same, right? And it's just moving, well, what do you want to do, the priorities? And usually then you start having the conversation as packaging, right? If you do all of this and you commit to this now, we're able to do this and add value to it, right? You can do it, a la carte. And here's a list of a la carte, but this is going to be the price if you do a la carte and stuff. And I'm okay with that, right? Because some people just don't. And usually they will be like, well, how much is the bundle? And then you tell them the price. And my favorite objection for women is, I got to talk to my husband. I don't really know. And then my answer, because Aaron and I were guys, so my answer is always, well, if your husband is anything like me, like I would never say no to my wife, right? And then they'd be like, oh, no, he won't say no to me. And I go, well, then, so what is the problem? Because if they're hesitating and stuff, well, I don't tell them what is the problem. In my mind, that's what I say, right? So you are trying to find out what the problem is. So I don't let them leave the room without me finding out, well, did they really have the objection because of the price? They can't afford it. Because in Erie, I do have a lot of people that just simply can't afford it. And you want to know that, right? And then 2 is, or are they not clear as to my treatment plan? Because oftentimes I find that they get so overwhelmed because we're talking about volume, laxity, and color, and there's all kinds of different treatments and stuff. They just get overwhelmed and they don't want to hear, and then when they see that price, it just shocks them. So when they do that, I go back and say, well, listen, if it's a price issue, what is your priority? And then you can let's start with this and this. That sound reasonable, and usually you dial that down. Now they're paying retail for it, and then they would do it. Or they just say, well, I just don't understand why I have to do more PSA than Lumecca, than whatever, and you sort of sit down and explain to them the reason again. And once they realize that, I find that they're more open to it, and then we're able to convert that. And if we do this process over time, our record in our clinic is about 80 to 85% closing rate, every day. And if we hit below the 80%, I start getting concerned, because then I go back and review the process. Where are we? Are we not doing the intake correctly? Are we not, talking correctly? And then, I sit down. And fortunately for me, I've been doing this for like 6 years now. It's just my PN and I, so we are on the same page almost on a daily basis and stuff. So it makes it a little bit easier. But you got to get to the point where the consultation is consistent, so you can measure your outcomes and stuff. And that's how we do it in my clinic. Okay, I share this with you. I think Unreasonable Hospitality is a great book for you to think about how to provide service, because we're in a very competitive industry. That guy's industry is even more competitive than ours, and he shares some of the little details of how the strategies and detail how he kept 11 Madison Place the #1 restaurant in the world 2 years in a row. And I think there's some value in that. Okay, and of course, there's all kinds of motivating type of books and stuff. And again, I find that he's a sales guy for what we do. If I don't like sales, we're doctors, but the skill set still needs to be there. The concept needs to be there. We're never trained on how to do that properly. And I think, he's got a lot of value there that, if you shed some insight into how you approach a sales to be successful in terms of closing the deal. Okay. And with that, my other thing that I talked about a little bit is free media. It's free, right? So when I first started, I don't have a whole lot of money to pay for SEO's website and whatnot and stuff. So the quickest way for you to be the local expert in what you do is to get the local media involved, right? Get them excited, give them free treatments, especially the anchors or the reporters or whatever, and bring them into it. They can do a story, you give them a free treatment, and then they're happy, right? And then whatever new things that you're launching, you invite them and stuff. They're happy to come because they know they're going to get a free treatment. So that's what I did. And in my local sort of area, Jill McCormick is sort of the anchor and stuff. And I gave her all kinds of free treatments and stuff. So whenever I have a new stuff, she knows I have new stuff. She would say, oh, do you want me to do a story? And she'll bring her crew in and we do a story. And that gives you sort of local credibility. It's free. And, you'll be surprised how much marketing success you gain from that. And that's all free. Okay. So if you're just doing Botox and filler, obviously, hopefully, we have convinced you that you need to get devices, and we have convinced you that devices bring in increased ROI, and not only that, this is where you have to be to provide the standard of care for med spa in 2025, right? And you want to be the leaders in it, and I think InMo is a great partner to do that for their technology, their post-sale support, and also, of course, education. And I feel like every time I come to these type of meetings, I meet really cool people, and we sort of exchange ideas. And this is how we're going to get stronger in the industry, by sharing ideas and helping each other out. So, again, this is my favorite quote. Once you decide you're going to do something, I don't ever look back, and success is not final, so I'm always constantly looking for the next new thing, right? But failure is also not fatal, so you can't quit. So it's really the courage to continue every day to innovate, and that's why I think InMo is a great company, because that's what they do on a daily basis and stuff. So I thank you for your attention, and really enjoy my weekend, and thank you for inviting me and to be here. So I'm happy to answer any questions, and Dr. Geller, we can do a panel. I don't know how much time we have, but I think I went over a little bit.
That was very informative. Thank you.